Okay, so I do understand that you're here for a plastic surgery consultation, and we will certainly be consulting about plastic surgery. That's on the agenda, definitely. I do want to let you know first and foremost that there will be no surgery occurring today. Good. Of course, you knew that, of course. It's just, you would be shocked at how many people believe that I'm just going to pull out the knives first 10 minutes and we're going to get laid out on the surgery table and I'm just going to go for it right then and there. No, these things obviously have to be planned. I do want to also let you know that for me and my practice at Paula's Plastic Surgery, at this practice at Paula's Plastic Surgery, a consultation about plastic surgery inherently includes a consultation about society, and maybe your childhood, because you weren't born wanting plastic surgery and your desire for plastic surgery didn't develop in a bubble. You don't live in a bubble. And so it's important that you understand why you want plastic surgery, and I understand why you want plastic surgery before we embark on a full-on surgery. I think a lot of times people downplay how serious plastic surgery is. It's surgery. Yeah, it's a huge deal. Could you find a practitioner, a plastic surgeon who would dive right into surgery, who would greet you knives a-blazing, ready to draw a diagram of absolutely every area of your body that you should change? Yeah, you can find that. I'm not going to give you a referral to someone like that. I don't really approve of that type of practice, but I'm sure you could find that on your own. Here at Paula's Plastic Surgery, we don't do a lot of surgeries. It's way more about the consultations than it is about the surgeries. And when we do a surgery, everyone is super confident that that's what we want. Everyone is super confident in that decision, and I think that's super important. Okay, so let's get started. All right, talk to me. Talk to me about why you came in today, or at the very least why you think you came in today, and then we'll end up talking about whatever we end up talking about, whether that be the thing that you brought in here to talk about or not. So, what procedures did you think that you wanted to have done? A rhinoplasty. Okay. A rhinoplasty is a nose job. Okay, I did not mean to imply that you're stupid. I didn't think you're stupid. I never did. It's just that your nose is so perfectly proportionate for your face, so idyllic in terms of, like, if I were asked to choose the perfect nose for your face out of a catalog, I would choose exactly your nose. So I was just confused if you knew what the procedure was, because I was so immediately confused as to why you would want it. But of course, I don't know the interior structures of your nose too well yet. So I don't know. Do you have a deviated septum blocking your... No, you do not. You do not have a deviated septum blocking your path. You have, from what appears to me, pretty clear airways, pretty clear nostrils. Is that correct? Do you struggle with breathing at all? So is this nose job you think you want, like, purely for aesthetic reasons? Okay. No, but let's talk about why. So, this is not your true face shape, this is just an outline, but let's say this is your nose. Imagine it's more like perfectly, in line. The nose is the anchor of the face. And so it is so vital to have the right anchor. If you don't have the right anchor, the whole shit might collapse. I know I'm not a maritime expert, but that is a thought of perhaps what could be the case, you know what I mean? So in terms of nose anchors, it is essential that the nose be the appropriate anchor for the face. I'm of the belief that we're all born with essentially the correct anchor. Some people, through, breaking their nose or various other things, they get deviated septums. And deviated septums, like if your nostrils, like if this was you looking upwards, this is, like if I was looking straight up your nose, this is a non-deviated septum. And then a deviated septum would be like if I look straight up your nose and this nostril is pretty impacted, in terms of air and breath. But you don't have a deviated septum. If you did have a deviated septum, that would be a conversation we could have about your breathing, your airways. But you have no trouble breathing, right? And no blockages to the airways. So, it's just important that we not rush into things. Tell me, when was the first time you decided that the nose that you have now is not the one that you want? For me, I had an experience where a teacher was reading the book Witches or The Witches by Roald Dahl. Roald Dahl has all kinds of things that he said that I don't agree with. But, this isn't necessarily that. But, in the book Witches, there was this one part where they said, oh, witches have big noses. And I don't know if you've noticed, but my nose isn't tiny. And so all the kids looked at me, laughed, pointed, blah, 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 she's a witch, she's a witch. Meanwhile, in a different culture somewhere else, they tell stories about how witches have tiny noses, Like, all of it's made up. We have to understand that it's all made up. And that when you use physical solutions to solve made-up problems, you only create physical problems to match your made-up problems. And you create more made-up problems. It's a constant cycle. Because once you change the size of your nose, suddenly, you've got just these great eyes that go perfectly in proportion with the nose. If we were to change the size of the nose, make it smaller, suddenly these perfectly currently proportioned eyes are suddenly way gargantuan big and weird. Not that there's anything weird about any human face, but that's the thing. Is that right now, structurally, integrally, in terms of aesthetics, in terms of appeal, in terms of marketability, the nose is exactly where we want it to be. And it would be unethical of me to allow you, in this practice at least, to change something that is mathematically perfect, Okay, what else did you think you wanted? Liposuction. Liposuction? No. Who told you needed liposuction? My mother? Don't listen to a word she says. My mother says stuff like that all the time. It's all bark, no bite. She's just talking because she's insecure about her own self. It has everything to do with her, not you and me. Oh yeah, I didn't think that my mother literally said that to you. I was just kind of using an example of like the mothers in all of our lives that are criticizing our weight and saying that we needed to look different in this way or that. Okay. First of all, liposuction, not gonna happen. Yeah, no way in the world. You're perfect exactly the way you are, but why do you think you want liposuction? Your clothes are too tight in the arms, but too loose in the torso. You don't change your body to fit your clothes. You change your clothes to fit your body. I'm sorry that you've had the experience that, manufacturers aren't making clothes to accommodate your body type and the frequency that you would like, but honey, it doesn't make sense to change the body to fit the clothes. One is made of fabric, you know. One is something that you can do and undo and all of that. And then the other is your body, lifetime permanent surgery. Surgery. Liposuction. You know, it's the biggest scam, or one of the biggest scams in the entire industry, because, look, if you're interested in losing weight, that's not my business. You know, you could talk to a nutritionist or whatever else. If that is something that you want to do for your health or whatever, all of that. Liposuction is not losing weight, right? It is not doing anything for your health. It's certainly not helping your health. And it's also just taking a small amount of fat from those spots for a limited amount of time. And then you've got an injection site, honey. You know what I mean? Like, just again, I have so much the feeling of just the danger level of these surgeries, right? They're way more dangerous. You're getting put to sleep, you know? And I don't know what this drawing, you know, necessarily means, but let me draw it more accurately. You're getting put to sleep, you know? You're under. You're sleeping. And you're being injected. And we're sucking a naturally occurring product of the body out of you. The body has that fat. Bodies without fat die. You know, I don't say that to be morbid, I just mean it. No, the body needs the fat. And in terms of how much fat a body needs, look. Let's just say there's somebody that envies everybody else's body. Everybody else's body type. There's somebody that envies it, that wants that exact body type but doesn't have it. Look at this. Look at the sculptures. Look at the sculptures of the women from previously, and it's like the ideal woman was a woman that does not look very similar to, you know, the Victoria's Secret model. Don't get me started on Victoria's Secret, but long story short, if you need to lose weight, which you do not, first of all, medically, you do not, whatever. But if that's a conversation you want to have, that's not a conversation to have with a plastic surgeon. That's a conversation to have with a nutritionist, with somebody else, with a guru. I don't know who does that. But liposuction is not weight loss. Liposuction is surgery. Big surgery. Okay, anything else? Don't be scared to say. You can say a BBL. Okay. A BBL. No, absolutely not. We're not doing a BBL. No way in hell are we doing a BBL. We don't even do BBLs here. BBLs are one of the most evil surgeries in plastic surgery, I would say. It's like 1 in 3,000 approximately people who get a BBL pass away from the BBL. Because here's what happens, right? Here's your skin, here's your fat, and then here's your muscle. I'm gonna make this muscle, right? And then here's your vital organs. In the case of your gluteus, no, you don't have a vital organ there. But here's your bone. I don't know, here's a bone. And like lots of nerves, lots of really important ones, lots of really important veins. Big important vein number 1, big important vein number 2, etc., etc. Now you inject. How a BBL works. Say this is your leg, right? You're laying on your tummy. Here's your butt. Your butt is not this flat. Your butt is not flat at all. Your butt is absolutely perfect size in proportion to the rest of your body. And is absolutely the ideal butt kiss. Bootius. It's the ideal bootius. Absolutely couldn't be more perfect. Okay, but here's the thing. So here is your skin, right? Oh wait, let's do a whole layer of skin. That's the skin. Then we'll do the fat as this. That's the fat. And then that's the muscle, that's the bone. BBL, you inject fat from somewhere else in the body. into ideally the layer of fat. That increases the layer of fat, and suddenly the layer of fat goes like this, and it pushes the skin up, etc. Now, here's the thing though. And I, of course, would be careful if I did BBLs. I don't do BBLs because they're very dangerous, because it's very hard to gauge. If you accidentally shoot past the fat into the muscle, boom, goodbye, you're dead. You're dead. And like, that's what I want people to understand about these plastic surgeries, is they're a big deal. I think people hear the word plastic, they think, oh, my Happy Meal toy. Oh, you know, my, what else is made of plastic? Is slime made of plastic? I don't know. My markers, my toys. Toys. Plastic is a toy. Toys, plastic. It's not well, it is permanent, right? We think plastic bottles, we think reusable plastic bottles, that's more permanent. But, you know, if you think, oh, I just get a plastic water bottle out, you know, Aquafina or whatever, we think, oh, that's just a flippant thing. Plastic, I think, is a term that feels flippant. It's surgery, it's surgery, it's surgery, it's surgery. It is a permanent surgery that can have lifelong things, lifelong effects, and, you know, more and more is coming out. Look, I don't do plastic surgeries often. I know, I'm a plastic surgery office, and I'm rarely doing plastic surgeries. But I have done them before, you know, like when someone has their double mastectomy after cancer surgery, I'll give them their breast implants because that's what they want. And that comes from, you know, something that I can't deny them. However, I'm going to deny you the things that your insecurity says, because your insecurity is not going to go away with the surgery. In fact, I find that insecurities really increase with surgery. Suddenly you think everything looks weird. You're like, oh no, my lips look weird. Oh no, my earlobe looks weird. Oh no, my shoulder blade looks weird. But none of these things look weird. They're just doing body part things. Oh. I'm passionate about it because I lost a daughter to plastic surgery. She didn't die, but she did change irrevocably. Suddenly her eyebrows are up here. They used to be a normal height. You know, suddenly her cheekbones are so prominent, and her cheeks are sunken in like Madonna sucking on a fish, because she got the buccal fat surgery, where you take out a little piece. This is the only piece of fat. You don't get any more buccal fat. She took it out. I don't know how I raised her. Got the most anti-plastic surgery that's ever existed, by the media, social media, the current influencers. I don't know. It's my fault, right? I must have slipped up. She went to that evil Dr. Plastic across the way. I hate that man for what he did to my daughter. And of course now she is regretting it, as they all do. She's wishing she could go back in time. She looks 37, and she is 22. So I want my horror story, which is not in fact my own, which is in fact my daughter's, to be the, you know, cautionary tale. Your face is loved. Your face is loved. You are loved, and your face is loved, and your body is loved, presumably. If not, that's a whole nother issue. I know some matchmakers. One, her name is Gina. She's incredible. I could set you up with them, but here's the thing. I just think you're too perfect. Sue me. And people have, and I have been sued. And I've been sued multiple times for refusal to perform surgery. You know, You take some, you lose some, you win some. You do what you can. You stay true to yourself at the end of all the days. Stay true to yourself, you know? Don't you go to that Dr. Plastic. Now that's the ultimate betrayal. Don't go to that Dr. Plastic, please. I hate that man. I hate his guts. All right. I guess I'll send you on your way. Okay? Believe in yourself. All right? Please. Seriously. Like and subscribe. That'll help. That helps self-confidence 99% of the time. And love yourself.